So we're going to start off here with shoulder rotator cuffs, and I'm going to go through a little bit of anatomy, so bear with me because I think it's important for you to understand what this structure, the shoulder, this fascinating complex structure can do. And it's a really fascinating joint. All right, so in general, what is a rotator cuff? I get a lot of patients that get confused about that. Is it rotator cuff? Is it cuff? In medicine, it's rotator cuff, so C-U-F-F. And this is just simply an area of tissue that's essentially made up of multiple muscles that are grouped in and around the shoulder, and they surround the bone in your arm. So right here in your arm, those muscles come together to form essentially a cuff around that region. And I'll show you that here in a minute. And then the idea is to essentially what we call the glenohumeral joint, which is here. It's simply the main shoulder joint. And it's important to know that we have two critical joints there in the shoulder, really technically three, but we talk most commonly about the two. One where the arm bone, the humerus, interfaces with the shoulder blade. And then we have the collarbone or the clavicle bone as it meets the shoulder blade as well up on the top. So, all right, and so and the rotator cuff is in very close proximity to those joints and helps those joints function properly. And you can see a list of the muscles here. We don't have to get too detailed, but the big one you need to probably know about, because the bulk of the damage when people come in is in this supraspinatus. This is a super common area. The overwhelming majority of rotator cuff tears are going to exist in that, and there's some reasons for that. One primarily is it's just a naturally weakened point, and because it takes a lot of the brunt of gravity and movements, and it's a relatively thin muscle, that tendon can get damaged pretty easily.